When you nod off, do you feel like you just fade out? You do not. Your body does a careful handoff. Brain, heart, and lungs switch gears on cue. Let's watch the first 10 minutes after lights out.
Picture a quiet bedroom.
Your eyes close. Within minutes, the brain's rhythm shifts from a relaxed buzz to a drowsy hum. Scientists call that buzz alpha and the hum theta. Your heart eases down from daytime pace. Your blood pressure starts its nightly dip. Your breathing gets a little slower, and it evens out. In a sleep lab, this change is clear. A 35-year-old volunteer lies still. About 7 minutes in, their brain rhythm slides from alpha to theta. Heart rate falls from around 72 to about 60 beats per minute. Blood pressure drifts down by 10 to 15%. A small bump of noise in the hall triggers a single big brain wave. That is a K complex. Breathing barely flinches. Oxygen stays steady near 96%.
Now the switch
That makes this possible. Sleep is not passive. A tiny hub deep in the brain flips sleep on. It is called the ventrolateral preoptic nucleus, or VLPO. It releases calming signals named GABA and galanin. Those chemicals press pause on your wake circuits. The flip happens fast, so you do not hover in between. This flip is a bit like a safety switch. The brain uses a latch called orexin. You might also hear hypercretin. Orexin keeps you from snapping back and forth between sleep and wake. During the day, orexin holds you up. At night, low orexin helps the sleep side stay on. 2 daily signals set the stage before bed. One is adenosine, which builds up while you are awake and makes you sleepy. The other is melatonin, which starts rising 2 to 3 hours before your normal bedtime. At the same time, your core temperature is drifting down. Cooler core, rising melatonin, and high adenosine nudge the VLPO. The handoff sticks.
Now the heart shifts
Into service mode. The brake system of your nerves takes over. It is called the parasympathetic system, mainly through the vagus nerve. Heart rate drops by about 10 to 20% compared with your day. The beat-to-beat pattern gets a little more springy. That spring is a healthy sign of calm control. Your blood pressure dips too. About 10 to 20% below your daytime average is common. This nightly dip is like a reset for your vessels. Your body uses pressure sensors in your arteries to keep things steady. That reflex helps hold pressure in a safe range while you sleep. Not everyone dips. Some people drop less than 10%. They are called non-dippers. Over years, that pattern links to a higher risk of heart trouble. Age, fitness, salt, stress, and meds can shift this. If a doctor ever checks your pressure overnight, this is part of what they look for. Breathing changes as wakefulness fades. When you are awake, part of your drive to breathe comes from simply being awake. As you fall asleep, that drive eases. Chemistry takes the wheel. Sensors for carbon dioxide and oxygen guide your breath. Because you are calmer, you breathe a little less air each minute. That is a 10 to 15% drop in ventilation for many people. Carbon dioxide in the blood rises by about 2 to 4 millimeters of mercury. Oxygen dips a touch. In healthy sleepers, oxygen saturation sits around 95 to 97%. That is often 1 to 2 points below quiet wake.
The airway itself relaxes too.
Those small muscles in the throat do not hold as much tone. Air meets a bit more resistance. In normal sleep, that is fine. Breathing in NREM becomes steady and slower. Many adults go from about 12 to 20 breaths a minute when awake to a calmer, more even rhythm. Later in REM, breathing turns choppy and irregular again. Your brain's response to blood gases also softens. The chemoreflex gets blunted during sleep. The response to low oxygen drops by about half. The response to high carbon dioxide falls by about 1/4 to 1/2. That is why sleep can unmask issues like sleep apnea. The backup systems are gentler at night. Meanwhile, the brain's own rhythm keeps changing. In the first few minutes, you enter N1. That is where alpha gives way to theta, which is a slower hum. Soon, you slide into N2. In N2, quick bursts called sleep spindles appear. Big single waves called K-complexes show up too. These help you stay asleep when the world makes small noises. Early in the night, deep sleep takes over. This is N3, also called slow wave sleep. The waves are large and slow, about 2 cycles or fewer per second. Neurons fire in a slow, shared rhythm. The brain's energy use drops. Cerebral blood flow falls by about 5 to 10% compared with wake. There is also a clean-up dance at night. In mice, deep sleep expands the space between brain cells by about 60%. That lets fluid wash through and carry waste away faster. In people, brain scans show slow waves in blood flow that pair with pulses of clear fluid. That fluid is cerebrospinal fluid. The two move in rhythm during deep sleep. Think of it like a night shift in a factory. Neurons idle lower for a while. Vessels and fluid pulse together in slow waves. The timing likely helps clean up. We do not know the exact amount cleared in people yet, but the choreography is real and it matches the deepest sleep. Temperature and timing keep this glide path smooth. Your core temperature drifts down by about 1/10 to 2/10 of a degree each hour in the evening. By dawn, the total drop is often about 1/2 degree to a full degree Celsius. Melatonin peaks in the early morning hours around 2 to 4 a.m., then fades. That cooler core and the melatonin signal make the sleep switch more stable. Deep sleep is easier to hold. Light at night, shift work, or jet lag can pull these signals out of sync with when you try to sleep. That can make the handoff bumpier. Now comes REM. The brain looks awake-ish. Areas for emotion and vision rev up. But the body is locked down. Your muscles are limp. This is called atonia. It keeps you from acting out your dreams. During REM, the heart and blood pressure get jumpy. Sympathetic bursts pop up. For a few moments, heart rate and pressure can reach or top wake levels. Breathing turns irregular. Even healthy people can have brief central pauses. Dreams ride on these storms while the body stays still. If you wear a tracker, you might notice some of this. As you drift off, heart rate drops by about 10 to 20%. High-frequency heart rate variability climbs. That is the vagal or calm signature. About 90 minutes in, you hit REM. Heart rate wobbles even though you did not move. That is a classic pattern. These devices are good for trends, not for medical diagnoses.
Sometimes the handoff is bumpy.
Asthma can worsen at night. That is not only sleep. Your body clock shifts airway tone and inflammation too. A looser airway at sleep onset can add resistance. In REM, irregular drive can add to the load. People with apnea feel this even more because the throat relaxes and can close.
Some heart rhythms also flare at night.
When the calm system rules. If you have symptoms, loud snoring or big oxygen drops, talk with a clinician. Small dips in oxygen can be normal. Bigger drops or witnessed pauses need a check. Morning is another handoff. As you wake, the go system returns. Sympathetic drive rises. Heart rate and blood pressure climb. Your control of breathing goes back to a mix of mind and chemistry. Heart events are more common in the morning. Hormones, sticky platelets, and the pressure surge all play a role. Both handoffs are high stakes. Your body nails them most days without you noticing.
Here is the relay.
In one sweep. A small sleep switch flips. Orexin steadies the change. Temperature drifts down. Melatonin says it is night. Heart and vessels enter service mode with 10 to 20% dips. Lungs run more on chemistry with steadier, slower breaths. The brain gates noise, slows its burn, and likely boosts cleanup. Then, REM storms arrive in a still body. Averages shift with age, fitness, meds, altitude, and health. The choreography stays the same idea every night.
Sleep is not a fade-out.
It is a well-timed relay you run every night. Thanks for spending a few minutes on your body's night shift. Sleep well.